Hi, I'm Steve Selig, the founder of FitTest. In this short video, I'm going to show you how FitTest is ideally set up to help any people working in cardiac rehabilitation to provide exceptional exercise services for your clients. So this short presentation is based on a very recent publication by the National Heart Foundation of Australia, published late in 2019. And it is designed for health professionals. If you're not a health professional, by all means, look at this video, but you'll have to involve other health professionals in order to guide you into providing exercise services for clients in cardiac rehab programs. The reference and the link for published by the National Heart Foundation is at the bottom of these next couple of slides. So just concentrating on exercise and physical activity, where we want to give cardiac rehab participants a tailored, progressive and supervised exercise training program. And we want to educate participants about strategies to increase general physical activity and reduce sedentary behaviour. Now, importantly, there is, within the guidelines, there is a strong recommendation to perform an initial assessment, and for that matter, an end of program assessment if your program has a cutoff. Now, FitTest is ideally set up for not only doing the initial assessments and the post-program assessments, but also for tracking your client through a multi-week program. The recommendation by the Heart Foundation for exercise assessments at the beginning of a program is to provide what's called a symptom-limited exercise test. And this can be done typically on a bicycle ergometer or on a treadmill. And this can be either one of the published protocols, which you can certainly use FitTest for, or you can customize your exercise assessment. And I've given a lot of information and other videos and articles on my platform, FitTest, myfittest.com.au, to guide you in how to do a customised symptom-limited exercise test for each individual client. So this is a very strong recommendation. You can use other options, such as submaximal exercise evaluations. And I would just say this, because I operate my own practice outside of a hospital, I do certainly use and rely on submaximal exercise evaluations 9 times out of 10. And it's quite rare when I actually go to perform a peak exercise capacity assessment. This would be in the setting where you've got safety backup, typically in a hospital environment. But if you're not in a hospital, you need to be sure that that client is capable of going all the way to peak exercise capacity for that assessment. It might be clients who are intending to exercise at very high intensities. But I would say mostly you can use FitTest beautifully to perform submaximal exercise evaluations, and that's exactly what I do. And I've given a lot of information on the platform on how to do that. So that's my strongest recommendation of this slide. In terms of 6-minute walk test, I don't like it because it is a single point exercise test, and it's almost impossible to prescribe exercise individually and scientifically based on the results from a single point test, such as a 6-minute walk test. However, it is permitted within the National Heart Foundation recommendations, and so I've got it there. You can also do incremental shuttle walk test, but if you have a treadmill, or even if you have a walking track where they can keep walking in the same direction and not having to turn directions, such as in the shuttle walk test, that is my preferred. I prefer if someone can walk in the single direction on a treadmill or in a single direction on a walking or running track, and where you can measure the speeds. And don't forget, most of the fitness watches now have a really good method of measuring walking speeds, as does some of the free apps that you can get put on your smartphone. Now, just coming to the bottom part of this slide here, what we are wanting to do is assess exercise tolerance at the beginning of the program in order to develop an individualised exercise prescription. This is absolutely what FitTest can do. We then, so the assessment and tailored exercise prescription is completed. We're able to then communicate that to the healthcare provider, usually the primary care medical practitioner. We can then use FitTest beautifully to reassess our clients and to reprogram the exercise prescription as you go along. Because the exercise test can be as simple as just doing another exercise session. It's that easy to do, or even within an exercise session. So you can keep tuning the program up or down depending on how well the client is going. And that revised exercise prescription can then be communicated to both the client and the primary care medical practitioner. So just a little bit more guideline on exercise training and physical activity for people enrolled in cardiac rehabilitation programs. We know that 30% of heart disease is caused by physical inactivity, and exercise is a tremendously powerful tool for improving the clinical status of people undergoing cardiac rehabilitation. In other words, people with significant cardiovascular disease. I'm not going to repeat what is written here on the slides. You can have a look at that by stopping the video. But down the bottom here, there's an important point here. By increasing adherence to exercise, we can reduce hospital admissions and increase health-related quality of life. Now, this just summarises my approach and how FitTest can be used beautifully to do the things I've just been talking about. So what we can do is do an incremental exercise test, limit it up to symptom thresholds here. So because I operate outside of a hospital, I would stop on the appearance of any adverse signs or symptoms. Whereas if you're in a hospital and working with, say, a cardiologist, you can proceed all the way up to someone's peak exercise capacity. So, and from this, FitTest will be able to process these results, and we will be able to program that client within this green area here to give them a safe and effective and individualized exercise plan. So just finally, my app is myfittest.com.au. You can contact me at info@myfittest.com.au, and I wish you well, and I hope you can use some of the suggestions I've given you here. Plus also, if you're a health professional, or even if you're not a health professional, go and look up that resource as published recently by the National Heart Foundation. So have a good day and goodbye for now. Bye.